Can you tell me what's been going on?
I was raking leaves in my front yard and I just have this knot on my back and it's been hurting pretty bad. So,
Okay. How long ago was that?
I'd say about a week ago.
A week ago? Okay, so it's been a little while. Are you having pain now?
I'd say it's about a 4.
A 4? On a 0 to 10 scale, 10 being the worst, 0 being no pain at all? 4. Okay. Do you mind if I go ahead and take a look at your back? Okay. You could stand up, and I'm just going to lift your shirt up. Okay, so it doesn't seem like you have any redness or swelling. Looks maybe a little sore, but can I have you go ahead? I'm going to measure your range of motion. If you could just side bend to the right, and I'm measuring. You could side bend to the left. Okay. You're a little bit limited in your range of motion there. If you want to take a seat. What I'm thinking for you, since it's been 7 days, it's been a while, doesn't look like there's any swelling. I'm thinking maybe you want to try some heat. Could help with your pain, could also help with that range of motion. But before we do, I want to make sure you don't have any things that would lead us not to use heat. So do you mind if I ask you a couple questions?
Sure.
Okay. Have you had any recent trauma to your back? Anything that may cause bruising or bleeding or anything back there?
No, I haven't.
Okay, nothing like that. Have you ever been diagnosed with a blood clot or blood clot in the leg or at all? Okay. I'm going to go ahead and check your sensation real quick. Can you go ahead and tell me where I'm touching you, whether inside the leg or outside the leg?
Inside,
Inside. And which leg as well?
outside of the right leg, outside of the left leg, inside of the right leg, outside of my left arm,
And can you make sure your eyes are closed for me as well?
outside of my right arm, my left hand.
Okay, good. Okay, so your sensations, sensations looking well. And have you ever had any surgeries where you've had metal in your body, any joint replacements? Nothing like that. Any problems with your circulation, blood pressure issues?
Not that I know of.
Not that you know of? Okay, well, just to make sure, I'm going to go ahead and take your heart rate and your blood pressure. Taking blood pressure. Okay, both of those are normal. 60 beats per minute for your heart rate and 120/80, so perfect, just what we want. Have you ever had any problems in the heat, dealing with the heat? No?
I love it outside in the summertime. So.
Oh, perfect, okay. And then have you been diagnosed with multiple sclerosis? Okay. Well, before we go ahead, you look like a perfect candidate, so just want to tell you some things that could happen, but we're going to do everything we can to prevent them from happening. We're going to use heat, so it's going to be, you're going to feel a hotter temperature. What potentially could happen is the risk of burns. Your sensation is good, so as long as we keep an open dialogue and you tell me how you're feeling, if it's getting too hot, we can move things around. We'll have plenty of towel layers, so it doesn't get too hot. We'll have a bell if you need to get my attention at all. And along with that burning, you can get some skin damage or something. But again, we're going to keep an eye on that. And your blood pressure is fine, so we don't have to worry about a drop in blood pressure causing fainting or anything. That will make sure you're comfortable, and we'll be keeping an eye on you. So do you have any questions for me?
I do not.
Okay, let's go ahead and get you set up. So, welcome to our treatment facility. We're going to have you on your stomach on here for the hot pack. Before we do, I wanted to make sure I forgot to ask you earlier, are you pregnant? Maybe. Okay, no chance of pregnancy. And have you had a history of cancer at all?
No.
No cancer. Okay. Those are two things, again, we don't want to use heat for. The treatment, what we're using for this heat is, one, it's going to help with your pain, and it'll do that by interrupting your the pain signal to your brain by stimulating the nerves that receive heat. So your pain can really only sense one sensation at a time. And so by overloading those thermal receptors, those receptors that sense heat, it'll cancel out or block the signal to your brain that is transmitting pain. So your pain should, we're hoping to decrease that. And then as far as your range of motion, the heat, what it can do is kind of increase what we call tissue extensibility. Or if you imagine if you leave maybe like a candy bar or a piece of gum out in the car and during the summer and you come back and it's real long, like taffy. So that's what we're hoping to do with your erector spinae muscles back there, your back muscles, is to get more range of motion from there. So does that make sense?
Yes.
Okay. And does this all sound good for you? Do you want to give this a try?
Yes.
Okay. So I'll give you go ahead and if you want to lay prone or on your stomach, I have a pillow here for your head. Okay. Now I'm going to go ahead and lift your shirt up just a little bit. Okay. And what I have 6 towel layers here. This is since we're first time doing it, we want to make sure that we don't overheat or cause any things. If this is too much, the next time we can take out layers. If it's not enough, the next time we can add layers. So I'm going to go ahead and put this here. Now you may not feel warmth right away because it may take a little bit. I'm going to give you this bell. If you need anything during the course, go ahead and ring that. This will last about 15 minutes. And I'll be back. I'm not going to be here the whole time, but I will be back in about 5 minutes to check on you. And if you need me before then, feel free just to ring the bell, and we can make any adjustments we need to. So does this sound good? Are you comfortable here? Okay. So I will be back in 5 minutes. Okay, so it's been 5 minutes. How are you feeling?
I'm a little uncomfortable.
A little uncomfortable? Okay. Is it your position?
I think so.
Okay. Well, what if I'm gonna take this off you so it doesn't move around. Can you go ahead and maybe bring your pelvis off the table? I'm gonna slide this pillow under there. Does that feel any better? Okay. Yeah. So that'll take some pressure or some tension off your spine. Now I'm gonna put this back on. And your back looks good. It's a little warm, which is what we kind of want. My hands are really cold. Sorry about that. But I don't see any signs of burning or any adverse signs. So I'll go ahead. Oops, give me a ride and put this back on. And again, you got about 10 minutes left. If you need anything, just feel free to ring the bell, and we can make it. All right. Okay, so it's been about 10 minutes. Go ahead and take this off of you. How do you feel? Can you feel the heat in your back at all? Okay.
Feels good.
Feels good. Not too much. Okay. So 6 layers. If you want to go ahead, if you can sit up for me here, and just get up slowly. You've been laying down for a while, so if you can just sit on the edge here. So you feel good. Can you tell me how, if you had to rate your pain on that same scale of 0 being no pain at all, 10 being the worst pain, how are you feeling now?
I'd say a 1.
A 1? Okay. Well, we started at a 4, so now we're down to 1, so that definitely helped. I want to go ahead and look at your range of motion again. So if I could have you stand up. I'm going to lift this shirt up a little bit. And if you could bend to the right for me. Oh, much better. And then to the left. Good. Okay. Well, we got an extra about 15 degrees on either side there, so that's really good. And the pain is decreased. So I think this is something that definitely worked for us. We can continue to do this in the future. What we're going to want to do now is to maybe strengthen some deep core muscles and stretch out that back as far as exercises. But I think doing this before the exercises will help with both the pain, being able to do them more, and then getting that more extra range for the exercises.
Okay.
So we'll continue with this as long as it seems to be helping, and then do our exercises, and we should be good.
Great.
Okay.
Thank you.
Thank you.